series covers a wide range of topics on wealth and health, the latest market outlook, and more. Today, we have invited Dr. Leong Ho Nam, an infectious disease specialist, to have a fireside chat with us on living with COVID-19 and why are the cases increasing despite the high vaccination rate. Now, before we proceed, let's run through some housekeeping rules. The chat box is available if you have any connectivity issues. Polls will appear on screen for your selection and the results will be shared. Click on the Q&A to ask your questions and click on the like button to upvote the questions raised in the Q&A. Scan the QR codes with a phone to access feedback forms and to download the page or click on the links available in the chat box. For those who join us for the first time today, welcome. UOBAM is a leading trusted regional asset manager that has investment experience of more than 30 years. We are wholly owned by UOB, one of the strongest banks in the world. And here is a quick recap of our purpose, vision, and strategic pillars of UOB Asset Management. Our purpose is to create value for our investors and to help them achieve their goals and aspirations. Guided by our vision and strategic pillars, we invest for profit and purpose while shaping a better world for our future generations. As of end of July, we have more than 90 investment professionals across 10 markets in Asia, managing our clients' 38 billion worth of assets. Our accolades in Asia saw us receive more than 210 awards, and UOBAM and our regional offices have won a trail of prestigious house awards. The consistency in our performance is testament to our strong investment management capabilities, as well as disciplined investment approach. Do visit our websites for the full list of our awards. As with our focus on sustainability, UOBAM is one of the first regional asset management firms in Singapore to join the United Nations PRI. As a UN PRI signatory, we have committed to fulfill the key obligations as listed. Now, with all the usual introductions out of the way, before we invite our guest speaker, I would like to take two quick polls from the audience. Yeah. Can we have the polls, please? Right. Poll number 1. Would you go for a booster shot if you are already fully vaccinated? Yes, definitely. No, we have a few no's, and I'm not sure, and we'll wait and see. We have a resounding yes, definitely we'll go for a booster shots. And the second poll will be, what are your top concerns currently? The number of cases rising daily is very scary, especially in Singapore and around the regions as well. Now, that is my concern as well. The number of cases rising daily is kind of scary for us. Okay, now that we know that we are going to take the booster shot and our top concern is the rising daily numbers, let's go into the fireside chat now and let us welcome Dr. Leong Ho Nam. Dr. Leong is an infectious disease specialist in the private sector. You might find him very familiar as he has been on CNA many times and has given many interviews as well. Hi, Dr. Leong. Thank you for being with us today.
Thank you.
Next, I would like to introduce our moderator for today, Rishi. Rishi is my colleague in the BD team and is responsible for building up the open API capabilities for our UOBAM investment platform. Thank you for joining us today, Rishi.
Thanks, Bob. Thank you. Appreciate it.
Yeah. Please take it away.
Great. Thank you, Bart, once again. Dr. Leong, Dr. Honam, great to have you with us. A lot has been said, and it's been 2 years since COVID has started, and we are sort of reaching sort of the 2-year point, right? A lot of policies have been put in place. A lot of strategy from the government has been kept keeping us afloat. With 80% of the Singaporeans having been vaccinated, right? Could we say that we are reaching the end of the pandemic, or are we reaching the endemic, as they call it?
No, far from it. Okay, we talked about 80%, and that was the figure that was given at the beginning of the year. Last year was like 60 to 70%. And at the beginning of the year, people wanted 80%, and that was with the Alpha variant. That's the variant which the UK had. It was spreading all around. So up to May, Singapore was having Alpha variant. But for the Delta, if you have been following my news, my recommendations was 90%. And honestly, 90% is not achievable. Because you have to take away 10% for the children that are not vaccinated, that means practically everyone else needs to be vaccinated. And why do I want 90%? Is because it really is about the healthcare system. We wanted vaccinations first to actually try to reduce down increase the herd immunity and in turn slow down the transmission. So Delta virus told us one thing: you are not going to achieve herd immunity. Even though you have been vaccinated, I, as Delta virus, will infect you again. And in fact, they'll try to infect us again 3 months later and again thereafter. The second thing is the virus has shown that if you put up a barrier, I will overcome it. And this, they did it with Delta. And I can assure you, UOBAM participants, there will be another variant after Delta, and it's going to overwhelm all the vaccines which we have done previously. So in other words, whatever we try to do, the virus will overtake and beat us down. And it's not because of the vaccines that it's not working, but rather the people are not wearing masks and they're not doing their social distancing. There are a lot of anti-maskers there and COVID deniers. So when you deny them and then in turn, you do not respect it, the virus will infect and spread. Now, I can imagine one quick question. I'm going to address it very quickly. When you use vaccines, you are creating mutants that will develop against the vaccine. Sounds absolutely logical. The answer is no. Vaccines don't create mutants. In order for mutants to happen, the virus has to replicate. If the virus don't replicate, you can have a wall of lousy vaccines, but there's no replicating virus, so it will never overtake it. In other words, it's just the absence of mask, the disrespect of the virus, keeping no social distancing, that will propagate the virus, replicate the virus, and in turn create the mutants. I'm going to take you all back to the question, where did Delta come from? Did it come from countries with a lot of masking and good masking? No. It came from countries where there was a mask policy issue and poor compliance. And indeed, the next one that will come similarly. The beta strain, which comes from South Africa, the P1 that comes from South America, comes from places where there's poor masking. So coming back to the question, 80%, we're not cutting it. The virus will overcome everything. And in truth, we are literally sitting ducks. All of us. And I'm going to make it very clear now. Everyone will be challenged with a COVID virus. Even you are stuck at home, and I'm going to use this rather inappropriate phrase, you might be 6 feet underground in the bunker. But when you come out to assess for food, you'll be still exposed to the virus. So everyone get ready for a rough ride.
So could you say that the second jab, has it been effective in controlling this, or how do you see it then?
It depends very much on your marker. So it's like, for example, if I bank with UOB Asset Management, if I get a 3% returns on my investment, is that a good enough marker? Or should it be a 10% or 20% or 30% annual returns? It really depends on where your marker is. If your marker is to say preventing infection, that means anyone where you can detect the virus, then I can tell you the second shot is not effective at all. But if you look at the most crucial point, if you UOB assets management key role is that I will ensure you 3% return per annum without loss of your principal. That is the most crucial thing. Then I will say the second shot has done its wonders, because the most basic thing is prevention of life loss, people not dying. If you look at that as a marker, the vaccine has done a fabulous job. Consistently, those people who fall sick requiring oxygen and versus those who don't outnumber at least 10 to 20 to 1. And that is how good the vaccine is. So quick call now and quick insist, if you haven't gone for your COVID vaccination, please do so. I'm going to take you to the day just before the Japanese bombing started in Singapore. It's literally the week before. Everyone's telling you, pack up, get ready, because the bombs are coming. You might be hiding in your own house, but the bombs containing the virus COVID-19 will come and hit everyone. No one will be spared.
Thank you for that, Doc. Quite good insight. In terms, everyone had this question on the booster shot earlier when we took the polls. How effective do you see the booster shot on us, in general, because we see an expiry to the second shot as well, and we see that the booster shots are going to start pretty much this month. How effective do you see these booster shots to be?
Okay, great question. I'm going to stratify them. If your purpose is to prevent infection, that means number of people falling sick, then it is highly effective. So I like that very much because it will decrease the strain on the hospital system. If more people fall sick, in turn, I'm going to strain a hospital because a lot of the elderly, the 60, 70 years old, if you're a little bit on the obese side, if you have chronic illnesses like diabetes, chronic kidney failure, you will put you at risk. You're going to need oxygen and you will struggle, even with 2 doses of vaccines. But you're going to survive through because the healthcare system in Singapore is excellent. We will get you through that. There are only a few odd cases where they are more than 70 years old, terminal cancer, very, very ill, bedridden individuals where we won't be able to help. So for that, Mark, it will be very, very good. Now, if your question then is, Dr. Leong, you told me if I got my second shot, I'm unlikely to die. I'm less than 60 years old. Do I really need the booster shot? How effective is that? So if you're less than 60 years old, let's pick the cut really close. You're 62 years old, you have no diabetes, hypertension, and you're very, very well. You have had your vaccines, 2 shots already. For this group of individuals, if I were to take a booster shot, how much will it benefit me? The answer is, and my cutoff is not dying. If that's the situation, the booster benefit to you is very, very little. Because I'm going to go into a little bit of technicality here now. Immunity has 2 different arms. There's a B cell arm that makes your antibodies, and there's a T cell arm that kills the killer cells. So your first line of defense is your B cell arm, and that's your antibodies, and that's the one which wanes. So when your B cell antibody wanes, you get infected again. But how severe your illness becomes is dependent on your T cell arm. And the good news is that the T cell arm stays good. Once after vaccination, it stays good and persists on. But in the elderly, their T cell response are very, very poor. So even they lost the antibodies or they couldn't mount one, and when the T cell came to challenge, they couldn't cope. And with that reason, they died. So a young person, you see, I think both of us are very young. So we are young people. As young people, the booster shot may not be required because I probably won't die. But I'm going to challenge you all with, this is a very intelligent group here. But for myself, as a healthcare worker, as a frontline staff, I'm actually looking after COVID, and this is my part of my effort to help Singapore. I cannot afford to fall sick. If I fall sick, I'm going to lose one infectious disease physician out on the ground. I don't want to give myself too much credit. I'm literally at least a lieutenant or major fighting a war out in the front. If the virus takes me out and I'm out of service for 14 days, I think it will be a bit of a disaster for the healthcare system. Others will cope, but we lose a much needed arm. So all those in the front line, they cannot afford to fall sick. Can you imagine, just the healthcare system is very bordered now. 1-2% of the nurses and doctors are taken out. I don't even need a Thanos snap. I just need a Thanos whisper. And 1-2% of the healthcare workers are taken out. Can you imagine the burden on the healthcare system? That's it. The whole system might just collapse. So if you look at that, it's I cannot afford to fall sick, then you need a booster shot, even though it won't kill you.
Great. Thanks, Honam. But should there be something that people are concerned about with this third booster shot? Because some people are saying we are getting too many of this. Is it effective? And should I be concerned with in terms of health? Is it going to affect my health?
Good question. The short answer is no, it wouldn't. The people who have gone for the third shot, which is the booster shot, they've compared it with the second shot and they realize that the side effects are very similar. What you have had for the second shot will be very, very similar to the third shot. That's number one. Some people will say, can my body get stimulated 99 times? Or rather, okay, let's make it simple. Stimulated a third time, will it go into immune senescence? It means you just go sleeping. It's like Rishi and I will understand. Our wives will tell us the first time we listen, the second time we will still listen. The third time is like, I can't hear you, darling, I can't hear you. So that's the problem. Can you keep stimulating the immune system? Will you put it into overdrive and fatigue? The answer is depends on how you do it. If you do it at a sufficiently distant time, you'll be fine. But you can imagine, okay, just for the record, we know our spouses. If they keep talking to us every day on the same thing, very soon we will turn the volume off. Okay, so I don't want someone to go out there and say, I'm going to keep vaccinating every month because I cannot afford to fall sick. If you do that, you are going to create trouble for your immune system. So the earliest which I would love to give a vaccine for a healthy individual or for booster shot is at least 3 months. 6 months is a great timing. But if your immunity is 0 to begin with, that means you haven't even made the basic baseline, 1 month is perfectly fine. So again, we need to stratify according to different people.
Thanks for that, Honam. Another question from me would be, do you see that do you see the end is near, or do you see that this is going to take a long time before we sort of see some normalcy in terms of our living from pre-COVID to where we are today somehow?
Okay, I'm going to talk about the Singapore scenario as well as the world scenario. So the Singapore scenario is in the next 1 to 2 months, Singapore, you will be tested. You'll be tested on your total defense, you'll be tested on resilience, and how well the people can work together and work with the government. No, I'm not going to say work with the government. Work with the healthcare officials and the doctors and recommendations. If you are high resilience in that, you're going to coast through it with a hard knock on the shoulder. If we are not able to play ball with the health officials and the recommendations, then we are going to have a fall. So that's not very good. Singapore will be tested, everyone will fall sick, and majority will get hit with the viruses in the next 6 months to 9 months if there's no change in plans at all. In Singapore, we're hitting about 1,000 cases a day, and I predicted it in the Chinese press that we will hit 10,000 cases a day eventually. That's when the whole healthcare system will be put under strain. So I am very cautious and worried. But 6 to 9 months later, the virus would have hunted down. I'm going to use the word hunted down because we are their prey and the virus is the predator. they'll hunt down all those who are not vaccinated and will hit them with an infection. Then the healthcare system have a breather because the rest of the cases who are vaccinated will be easier. And then the engine chugs along and improves again. So that will be the situation for Singapore. I do envision some form of normalcy in June next year. I know we are opening up the air travel, but with the numbers so high, I think about our countries nearby might say, Singapore, actually, I don't think I want to accept that invitation. They might just turn around and say, Singapore, your numbers are too high. We may even close our borders to you. So that's my biggest concern. So Singapore, hard knock, and thereafter that, we should have some normalcy. Worldwide, there'll be two groups of countries, the haves and the have-nots. Okay, haves, then you have to look at whether are they compliant? Do they work well with the officials? If they do, they will come out well and fast. And one of the countries that will do so quite well is actually Israel. I must admit that the government has foresight and they've gone against, I want to stress to you, against WHO recommendations. Not that it's right or wrong, but that's their own decision. And they've gone on to do the vaccination and boosters. That's the right way to do, and this is helping the country, and they're going to step out of it faster. It may create a problem where you may need to have annual doses, but that's not fresh news. We knew that we would probably need annual boosters from the end of last year. So Israel will be one of those who has, and the numbers will start coming down. They'll be the first to lead out the pack. Other countries with haves like the Europe as well as North America, they will snap out of it faster and they will chug along with a baseline cases consistently. And yes, booster vaccines will be given to 60 years old and above. So again, they'll be very similar to Singapore, but they will probably attain it faster because they have allowed the virus to run amok earlier than later. In the case of Australia and New Zealand, where they technically can have, but they don't have the vaccines, they'll struggle with lockdown and containment, but they will go through what Singapore has gone through, failure to contain Delta. The Delta cannot be contained. And in this situation, they will burn through, they will try to contain until the vaccination hits. Then it goes into what Singapore has done. Now, there's a last group which I really hate to talk about because it really aches my heart. The countries with have-nots. The have-nots would probably have a very poor mask policy as well. So we have seen countries which are short of oxygen, hospital supplies are overfull, and you have seen those very heart-wrenching pictures and videos. They will go through yet another COVID like this. But this COVID virus will have a transmissibility of Delta. They spread very fast. And two, they will be able to overcome all pre-existing immunity. So you can imagine one country, very poor vaccine policies, they got hit very badly with many deaths, and practically everyone was infected with Alpha or Delta. The next one will come along and they relive that lack of oxygen story again until all gets a second time round. Then perhaps some form of herd immunity will develop. When I say herd immunity, means enough T cells response such that when I fall sick, I end up with a mild illness. In other words, it becomes a common cold. Is this unusual? Absolutely not, because there are 4 circulating strains of coronaviruses since we've started monitoring them. They probably entered the human population the same way, and there were deaths of many, many people like that. So very soon, COVID-19 entered with the 5th one, and then it starts circulating as a common cold. So Rishi and I will still go back to work with a bit of runny nose, and we thought that nothing happened because we didn't swap and we didn't know.
So, doctor, can you tell me, I think everyone's today, I mean, today people have children as well, and they are a lot of them are worried about how their kids, because some of them below 12 will not be able to, actually, all of them below 12 will not be able to take the vaccine. How will this, because kids will also transmit when going to school, how will this affect the herd immunity that we are sort of transitioning towards?
Um, I think that's a great question. So number one, the kids, if your kid's 6 to 12 years old, they will probably approve it in USA in the next 1 month, and Singapore should follow suit very quickly in terms of the safety efficacy data. Those people who are blessed to be less than 6 years old, not only will I be ignorant of the events, I will be ignorant of poverty. So in this group of people, unfortunately, the vaccines will not be available until next year at the earliest, because you need the trials to go through. But the good news is 99.99% wrong. I'll say that it's 99.999% of these children will do beautifully well. They would have mild illness, mild fever, mild cough, and after that they recover. And that happens for 9,999 people out of the 10,000 there is. But one of them will suffer badly. I cringe at the thought that one child may suffer badly from COVID-19. But that's the situation. In Singapore, you have about 40 to 50,000 live births every year. So that means you will have at least 4 to 5 children who die of COVID-19. Now, what do I do? Number one, I would actually make sure that all the family members are vaccinated. The studies have shown that once you get vaccinated, the risk of transmission is lower. Number two, the risk of you recover faster, so in turn you're less likely to spread to your children. Two, get them to get used to a mask as much as possible. I know it's extremely difficult. I've gone through a parent 3 times. Do what you can, but if it doesn't, then we just have to take it in its own stride. And literally, it will be just like another influenza, but this time around, there's no vaccine for this kid. So Japan family with kids, they're young, I'm really sorry, we just have to rough it out.
Touching on a topic, thanks Honam for that. Touching on a topic you mentioned a little earlier on the Delta variant, right? How come, or how is it possible that the Delta variant is more transmissible? And do you see it to be more deadly than the initial variant, or is this something that it sort of tapers off as the mutation happens?
Okay, great question. Now, it all has to do with numbers. We can break it down to numbers, and the bank loves numbers. For example, when we swap a person with the old strain, alpha strain, or we do it even more drastic. The first strain that came out of Wuhan, China, if we were to swap them, we'll find about 10,000 copies or 100,000 copies that are per mil of sample. But when we swap the same individual now with infected with, sorry, not the same individual, we swap the new individual now with the Delta strain, instead of finding 10,000 to 100,000 copies of virus inside per mil, I find about 1 billion copies of them. 1 billion copies. We're talking about 1,000 times more copies of virus there are. So then it becomes a very simple mathematics. 1 billion copies per mil, and then when I cough it out, let's say I'm infected now, I cough it out, 1 droplet comes out, and 1 upon 1,000 of it came out. So there's 1 million viruses comes out through my mask. But because I'm a good boy, I wear my mask, it filters off 95%. I still have 50,000 viruses coming out through the mask. Now, Rici's on the receiving end now. So he wears his mask, wears it well and good. It goes through the filtration, 50,000. 50,000, take away 95%, I still have about 2,000 copies. About that, 2,000 copies. 2,000 copies. Actually, honestly, 95 reduction twice is fabulous. From 1 million to 2,000 is very good. But you only need less than 100 copies of the virus to infect you. So what the virus did was to make itself more relevant, more transmissible by having a high progeny of viruses. And this happens even before the onset of symptoms. So you have lost it. I can't tell if Rishi is infected or not because he's asymptomatic, the same for me. And then I'll be talking to people and I lower my guard, lower my mask, and in turn I pass it on. So if I were to wear a mask and Rishi wears a mask, even though Rishi's get infected with 2,000 copies, he may have enough antibodies to just cope with the 2,000 because he's been vaccinated. Or even if he doesn't, the antibody falls, he will, because the amount of virus there is coming across his lesser, his severity of illness will be milder, which is good. And they have shown it in hamsters. If I breathe in less viruses, I am going to be less severe illness. So masks will stay on for a while. The second reason, besides having a numbers game, number two, they have a better quality binding. When the virus goes in like a lunar landing into the ship, the ability to attract and bind is so much better and so much more efficient. That means they have super powerful landing gears that catches, and then puts it on. Number three, not only do you know they have a spike protein outside, don't they? They have a lot more spikes. So the probability of having a random catch on the receptor increases. In other words, this virus is designed for one thing. The genetic mutation has designed it to be the number one virus because, like the Olympic Games, each of the progeny wants to be the outshining virus. And when you give it a chance, we give it to 1 million or 6 million viruses or people there are with the virus, eventually one will succeed and will have a super fast spreading, and that is Delta. Again, a reminder here, after Delta, there'll be something even more.
Once again, thank you. Your insights have been truly wonderful. How do you think Singapore has coped with this Delta, and do you think more can be done, or is this something that that the progress has been good from your perspective, at least?
I think this is about the best which we can do. So we'll talk about Singapore has locked down many times, and many people have suffered. Yourself, myself, and our very friends. If we really want to prevent the current strain of Delta, I'm going to use the word raping through Singapore. Terrible word, but that's how I feel. Raping through Singapore. The only way to do it is to have another circuit breaker, a CB2. And yes, among many national servicemen, there is truly a CB moment again, circuit breaker. So we in order to break that, we have to do that. But if you think about it, it is postponing the inevitable. Eventually, everyone will have to ride through it. And you know that the virus have adapted to overcome the vaccines. Then should we then go for everyone to get booster shots? Well, I don't think it's going to work because about 10% of the eligible people are still not getting vaccinated. If you look at the numbers, only about 1,000 to 2,000 more people are vaccinated every day. That's a pitiful, very abysmal number for about 1 million people that have not been vaccinated. That's terrible. 2,000 a day, it'll take us forever to reach there. So in other words, the more we delay, the only sole purpose is for the unvaccinated, and we're doing it so slowly, it's not going to make a difference. And ironically, when the government decided to let it out, suddenly you see a huge surge of demand for vaccines because people realize that I cannot procrastinate anymore. Procrastination was holding back many people. Again, the people or population in Singapore can be divided into three groups. Those who are willing to listen and do it straight away, or perhaps compliant, or understanding people. Those who absolutely refuses no matter what is thrown at them. The middle group is those who are sitting on the fence, and the purpose now is to get all those on the fence and all those who are willing to take the vaccine. Oh no, I'm left with the middle finger. what we need now is to really get those who are willing vaccinated to vaccinate, those who have allergy, who have not gone for it, to go for it. After that, the ship is moving. And that's the decision which they've taken. The timing, should it be August, should it be September, should it be October? Well, only history will judge us. I'm not going to judge that. Should we do it later? Should we do it earlier? No one knows. For those people who are looking after children, they want it later. For those people who have no children or grandchildren to worry about, they want it earlier. No one's right. It's like timing the markets. Should we go in now or should we go in later? So I would say that they are doing a good job in getting the vaccines. They were spot on in getting the vaccines. I think they were quite good in rolling out, except that I wish we could roll out much faster. They were saying there was a delay in supply, and I do know of some reasons why there's a delay. So I think it's understandable. But going forwards, I am very worried because many elderly have not been vaccinated, and the next 3 months, we're going to see a lot of deaths. So deaths, loss of lives, loss of livelihoods. Where do we draw the line? I think it's really difficult. I'm not going to play God, and I'm not going to say that it's right or wrong. So it really depends now on all of us, not just me, not just Risi, but everyone, to slow down the burn rate in Singapore. The burn rate, that is the number of people getting infected. If we don't do it, the hospital system will be overloaded, and that's when Risi and I, God forbid, if we actually end up a heart attack, we will have no base. At that point in time, Singapore will not only be brought down to its knees, we will be brought down prone, begging for mercy. And that's the worst nightmare for all of us.
That's unfortunate, but hopefully a lot more gets vaccinated then.
Yes.
Great thought. We've had the 2 jabs, and then we've had the initial variant, and then now we have the Delta variant, and we are going to have the booster jabs. How do you foresee, for example, whether does the booster jab, will it help against Delta variant, do you think?
Yes, it will. The data from Israel is that they have 11 times reduction in infection cases simply with a booster shot. So with that, I would strongly encourage people to go for the booster shot as and when they get called up. So the more than 60 years old, if you especially have chronic illnesses, or you have poor immunity, it's a no-brainer. You should just go for it. We get worried when you're more than 60 years old. If you are less than 60 years old, sit tight, because in truth, the chance of you vaccinated requiring oxygen is very, very low. We should let those other people go ahead first. And after those are done, we should consider letting those people who cannot afford to fall sick. So these are the key essential workers. This, of course, will include the police, the firemen, the essential services from electricity, etc. They should get vaccinated so that the life goes on as normal as possible. Then literally, then it becomes a waiting game. When will I get infected? When will I fall sick? And do I pass it on? So summary, when you get called for it, go for it. And perhaps one of the things, I'm not sure, Risi, if you want to address is, should I get a change in vaccine when I get called for booster?
That was my next question, actually, doctor. So, one is the change. The other one is, for example, people who get Pfizer, who have tried Pfizer the first time and maybe have had some adverse reactions. Is it okay for them to go to Sinovac or the alternatives, basically?
Okay, so in Singapore, there are actually 2 big groups of vaccines. It's either mRNA or the inactivated vaccines. So the mRNA will be the Pfizer and Moderna. The inactivated one will be the Sinovac as well as the Sinopharm. So let's do the easier one first, which is if you have Pfizer, my recommendations are to change over to Moderna. If you have Moderna, change over to Pfizer. My qualifying statement is this: there's no proven science that when you cross over, it will benefit you or it is safe for you. But if you think logically, it will be fine because they are of the same technology, but because they are a little bit different in the picture of it. So for example, if I have a twin brother and me, if you get somebody else, my twin, even though we are twins, there is a slight difference in opinion. And having that slight difference of opinion will give a more varied response and give you a more varied immune response to the virus. And that's very, very good, because the more varied it is, the more likely you can cope with the variants. The other way of looking at it is that if the Pfizer vaccine makes this 4 antibodies, and Moderna makes this 4 antibodies, and the two of them match here. So what's going to happen also is that these two are probably the most crucial, important antibodies. So I will have a boosting of these two most crucial antibodies and in turn improve my immunity. What of the other two? What of this one? That's fine. I have a more diverse response so that if the variants come along, I still can cope. So the take-home message is take an alternative vaccine. If you have Pfizer, go Moderna. If you have Moderna, go Pfizer. I must admit, no one has qualified it in tests and trials yet, but logically, it makes perfect sense. Next question then is, so what if I have the mRNA vaccine here and I have now, should I do it with the inactivated vaccine? The inactivated vaccine in terms of Sinovac or Sinopharm. In fact, you can actually buy yourself a Sinopharm vaccine now if you can get stock of it. It is available. The government will not control you. You can take the shots. So the problem is Sinopharm is not exactly a great booster. It doesn't stimulate the immune system as robustly as mRNA. If you do look at the science of it, it will help definitely. It will help in stimulating the immune system. Again, you have your mRNA, you have your inactivated vaccines, be it Sinovac or Sinopharm. They might meet in two of them, and you will boost this too. And in turn, you have a more diverse response as well. The question is the boosting enough? Is one shot of inactivated vaccine enough, or you need 2 shots of inactivated vaccine? Now, on this, I cannot give you a good answer because I'm still waiting to have my own anecdotal experience. My feel is it will boost, but not to a level that's seen with the 3 shots of mRNA vaccine. I'm going to say that again. The Sinovac and the Sinopharm and inactivated vaccines as a booster will work. It will definitely work. The question is it good enough? Is it going to be like a Tesla stock, or is it going to be one of the other, not another alternative Ford? That sounds like Ford. That's Ford stock. So how good is it? The answer is I don't know. And we will know gradually because Singapore is one of those unique places where you have Pfizer, Moderna first, followed by the availability of inactivated vaccine. So I'm going to ask you guys to watch this space. UOBA Asset Management can invite me again, and I'll let you know the details and the anecdotal experience comes in.
Great, thank you, Doctor. Thanks for that. Just conscious of the timing, in terms of timing and the Q&A that will follow with Bart. Would you like to share any parting thoughts from this fireside chat? Anything that our viewers would like to know, or something that you'd like to share?
The parting note is this. There's no escaping COVID-19. And even our own grandparents or great-grandparents, they will be exposed to it. And I can tell you countless stories where the helper brings it in, where the children bring it in, and those who refuse to be vaccinated, they fall sick. And they fall really, really sick. And when they fall sick, the burden is not just on the individual, but the family around, because they were to take time to visit, they worry, they can't focus on your job. I mean, Risi and I, if our parents fall sick, we can't concentrate. So if you know of a parent or grandparent who has not taken the vaccine, do it. And if you are one of those who haven't do it for your children, do it for your siblings. The second burden will be on the healthcare system because you're taking away one hospital bed. With the 900 cases which we saw yesterday, at least 90 of them will take up hospital beds. Can you imagine every day, Ministry of Health is losing about 100 beds in their own hospital. In 14 days, you have 1,400 beds lost. And this is one major tertiary hospital. Can you imagine Singapore without Singapore General Hospital? I tell you, we will be on our knees begging for mercy. So when you don't get vaccinated, you're going to burden not just yourself, your family members, the healthcare system, but someone else who needs a hospital bed more than you. So I'm asking you, if you're not vaccinated, please get vaccinated. I'm going to use the terrible word. Don't be selfish. Don't be self-centered because you're only looking at your self-well-being. But your lack of cooperation may kill someone, will likely kill someone downstream. I just hope it is not another relative of yours. Okay, so vaccination, unfortunately, is still the key. After vaccination, you have a big problem. You are unlikely to die of COVID ever.
Thanks, Honam. Appreciate it. I'm sure we'll meet again, probably more informally. I hand you back to Bart. He will probably share with you some of the questions, and people have sort of voted on certain questions they would like to be answered. Bart, over to you.
Hey, thanks, Dr. Leong. It's certainly very insightful. Now let's move on to the Q&A section.
Shall I just go through very quickly?
Okay, sure.
Rita, we have answered the question. Yes, it's good to mix. Ernest Lau, is there vaccines better than others? The current best vaccines now are still the mRNA in terms of efficacy. You get a third shot, you'll be fabulous. Any thoughts on the efficacy of Chinese vaccines? I'm going to say something really harsh, and I know it'll backfire on me, but I'm going to be perfectly honest with you here. Which are the countries that relied a lot on Sinovac, Sinopharm vaccines? It will be Indonesia, Mongolia, Chile, Seychelles, and Thailand. Which are the countries where the healthcare workers with good masks, good protection, who knows how to wear a mask, are still dying of COVID-19? Indonesia, Mongolia, Thailand, Chile, Seychelles. The point to it is Sinovac, Sinopharm works very well in the unmutated virus. If the mutated strain, the efficacy of it falls. So it's going to be an issue here. Help me answer live as I see them. Anonymous Senator, should we double mask in crowded places? Double mask is a good idea. In fact, not only do you double mask, you do a tie at the back of the ears with the handle. You see, when you actually just do a surgical mask like that, it's actually very loose. And then many of our Asian faces are very, very small, especially the petite ladies. So the whole thing was just drop over. And if you look at it, you need to have a good seal. It's like a bank account. If you don't have a good seal, one of your child or your spouse would leak it out and you lose more money. So you need to have a good seal by the side so that all the air that comes in comes in from the front. So you could double mask will help. Remember, double mask will help. Number two, get a mask extender such that you tie it behind so it stays very, very close to the face, and this will be great. K. Wong says, any thoughts on long effect? Yes, long COVID happens. The more symptoms you have, you're more likely to get it. Vaccination does reduce down the long COVID, and there are studies to show that already. Long COVID impact the quality of life, can even go for months. Honestly, long COVID is idiopathic. The doctor is an idiot and the patient is pathetic because we don't really have a treatment for it. So the best way is actually prevention, and prevention is vaccinations. When you're not infected, you don't get COVID. If you're infected with milder symptoms, you are less likely to have long COVID. The more severe illness, the more likely you're going to get long COVID. Is it more risky to work at home than office? Yes. When you go out of the house, you're going to expose yourself. So that's Louis' question. You go out of the house, transport, you're at greater risk. How do I take the cab? I wind down the windows and then let the air in. I say, uncle, switch off aircon, save money, economy. I wind it down, and of course, they still keep the aircon running. So the alternative are to take the mass transit or bus, double mask, tie behind, and don't talk. Don't talk. Listening to your Ed Sheeran and then stay cool. What kind of scenario could be considered safe for children to go out their homes? If you need to dine out and you need to go out, open air helps a lot. And keep your distancing at the same time. Get them to mask. Eunice Chua, mRNA does not change the DNA. 100%. When I got vaccinated for my COVID-19, all my children were praying that I look more like a K-pop star. It didn't happen. They were really, really disappointed. So I'm going to say this again, mRNA does not change our DNA at all. Those people who says it, who shares this information, unfortunately are going to kill many people. If you believe it, then it's like not investing with UOB Asset Management, investing with other banks. This is where you lose out. Do you recommend that we take the non-mRNA vaccine as a third jab? At this point in time, the only non-mRNA vaccine is actually the Chinese vaccines. The efficacy of it is unknown, so we don't know. Third dose of vaccine, does it have common pneumococcal component? No, those trials will take forever. You cannot wait. At least it will take 1 year or 2 years for it. And mind you, the whole world is manufacturing COVID vaccines and they have no time to do this mixing of it together. Taking pneumococcal vaccine serves as a second layer of protection. It does help. It does help a little bit, but if you need your baseline, your basic, okay, your basic thing, which is your COVID-19 vaccine. After that, you layer in. So even before you talk about investment, you must have savings. No savings, no talk. Is double masking good, better? Okay, if you want to do a double masking, if you can get a KN95 and KN94, it's very, very good. So, but you need to make sure it's really, really tight. But many of the masks don't fit well and you don't know until you try. And you can do a mask fit, which is a special procedure to test it. So, but if you have a KN95 and you can afford one, good on you. UOB Asset Management must be making lots of money for you. So what you do is you have to breathe in and breathe out and see whether there's air leak out by the side and leak, or does it leak out from the front. If all of them comes out only in the front, you're fine, it's good enough. So this is a quick check, not ideal, but good enough. What about China? Try to bring it down to zero, that's not possible. Does it mean that China will stay locked down for the rest of the world? Sue Lightfoot, I agree. Okay, I think China is going to get locked down. There's no way they're going to get out of it. You see, China is going to go for the third dose. They haven't really decided what third dose to do. It could be one of the other Chinese vaccines. Only then they'll keep the numbers very low. For the record, all of you who are wondering why China is doing such a great job, if you want to enter China now, you have to quarantine yourself for not 7, not 14, but 21 days. 14 plus 7. So if watertight 14 plus 21, it's like making you get 21 analysts to go through this one. Yes, I will select this portfolio. The US is open, full of stadiums. Not everyone's vaccinated. There are reports of hospitals getting too full. Vaccination states, vaccinated are not overwhelmed. If the US can stay open without hospitals getting too full, how come Singapore can't? Is our hospital capacity too low? Are we treating too many inpatients? It goes down to what death rates are acceptable for you, my friend. If your death rates of 1% is acceptable to you, I tell you Singapore will make the cut easily. You see, the death rates in US is much, much, much higher than that of Singapore by at least 10 to 50 folds. If we loosen it up and allow more people to die, our hospitals will be fine because the patients bypass the hospital. From home, they go to the mortuary. Okay, but that's not how Singapore lives. Singapore lives by trying to save every single person. Shouldn't we do our immune system checks before consider booster? You can. I can tell you 99.9999%, which is 1 in 100,000 to 1 million, you are fine. It will also cost you a lot of money. If you have too much of the money, go to a website called giving.sg. Randomly choose any of them and give them all away. But it is easier to actually just get your booster vaccine. Oh, I lost my list somewhere. Someone posted something. Sue Lightfoot, okay, anonymous. Okay. is endemic living given that is endemic living realistic? There's no choice. We are forced into endemic living. We have to just go with it. The virus is too clever, too smart for our own good. If I was vaccinated 2 doses of Sinovac, is it necessary to take antibody test? Anonymous attendee, I can tell you what your readings will be. But do you get the Pfizer vaccine? I know Risi did, because Risi and I are quite close. So Risi and Bart had the Pfizer vaccine. When Risi and Pfizer had the vaccines, immediately after, the antibody levels is at least 1,300 to 1,600 if you use one of those antibody tests. Another one will read you at least 92 to 95%. Now, if you had the Sinovac vaccine, your readings can be anything zero antibodies compared to Bart's 1,300. 20% will have zero antibody response, and that's coming from Chile data. And your levels, anything between 20 to about, the highest I've seen is 600. But 600 is unrealistic. Majority are be 20 to 200. Bart's case will be 1,300 to 1,600. In terms of percentage, it can be 1% versus I've seen up to 20%. Even I've got 30 or 40% before. But how much percentage do you need for protection? You need at least 80%. So in that case, Risi made the cut, Bart made the cut. So the one that makes the cut is those who have mRNA vaccine. So again, you're going to waste money if you go to antibody test. I can tell you, I have friends who, despite me convincing, they went for the Sinovac vaccine, and when they went for the antibody test, they freaked out at the numbers, and immediately they got themselves an mRNA vaccine immediately. You can read it about it. Look, Google search SCMP, Leong Ho Nam, and you can find an article on this, and it's published in SCMP. So Sean says, saying that second shot will prevent an individual from death, see a chance of getting COVID-19. By booster shot, then assure they will not get vaccine. No. If you get a booster shot, from an 80-90% chance of getting COVID, you come it down to about 20 to 30%. So you have a reduction in risk. So this is what UOBAM is. They reduce down your risk for your portfolio. They reduce down the risk of your exposure. It's about risk control and containment. But I believe even a booster shot, mask, and social distance, believe is important. Yes, I think it's still important. When I wear a mask, actually it's for my benefit as well as the person in front of me. And when I do social distancing, it cuts both ways, it helps both ways. How long do we need to wear the mask and social distancing? I think by the middle of next year, everyone's been hit by COVID. Everyone's tired. Those who want to get boosted are boosted. Those who want to vaccinate are vaccinated. I think the earliest will be middle of next year onwards, where it becomes mask-free. In fact, I think USA is going to say that it's no longer compulsory by the middle of next year. How long does B and T cell last for the vaccines? B cell lasts only for about 6 months, 6 months to 9 months in terms of good quantity. But T cells, it stays on for a long time. Now I'm going to add on this part to this question. There's a beautiful paper by Chile. Chile compared Sinovac versus Pfizer. Chile, if they monitor the antibodies by 6 months, if you had Sinovac, by 6 months of Sinovac, 60% have no antibodies detectable, 0. If you look at Pfizer, after 6 months, 95% still have antibodies detectable. But if you do the measurement of quantity, it will have fallen. So the question which the virus is going to ask you is, number one, are you vaccinated? Number two, do you have antibodies? The third one is, how much antibodies? So the only one where you will pass in all three is possibly with Pfizer, Moderna, with a booster vaccine. I've got Luan here who says that one shot AstraZeneca also have COVID and be negative for 30 days. You should do more vaccines. If you have had COVID before, you only need 1 shot of mRNA vaccines or AstraZeneca vaccine is fine. So Luan, go sign up for 1 dose, usually about 2 to 3 months later, and you'll be good. Eunice asked me again, does mRNA change the vaccine DNA? Nope, it doesn't. Do you recommend taking a non-mRNA to long-term side effects of mRNA? Well, the long-term side effects, after more than 1 billion doses have been given, we haven't seen that appearing at all. And I will tell you, Eunice, that mRNA vaccines were in trials and testing as soon as 2010. 2010 and 2013, they went to high scale and they were doing it for many, many trial patients. None of them became zombies like I Am Legend. Because if they were bitten all of us and we would all have died, and Will Smith would have died earlier before the movie. Okay, so no, we don't, it doesn't change. And the long-term side effects, if anything, will show up by 2nd or 3rd month. After that, you don't have anything because the mRNA doesn't last in the body for more than a week. That's the maximum. And they've done it with very sensitive measures. Okay, does taking pneumococcal act as a second layer of protection? Yes, it does, but you need a vaccine. Is it advisable to treat COVID as an endemic point in time? I think since we are in it, we just ride through it. There's anonymous attendant. Peter Chia, can you tell us more about long COVID? So after COVID, many people have the persistence of symptoms, even though the blood tests, x-rays, everything is normal. So these people will feel very tired. I can't get out of bed. I really can't. And these people are the ones who will cycle like Risi every day, or who will run every day, and suddenly they say, I can't get out of bed. I'm very tired. Or their persistent cough, persistent headache that doesn't go away. And that's long COVID. Some people think it's 10%. Some people have said it's 40%. But overall, I think it's in the region of 10 to 15%. So the best way to do it is to avoid long COVID. Again, it's idiopathic. The doctor treating it is idiot, and the patient is pathetic because we have no way to solve it. Will we get adverse effects after referring from COVID? Yes, many people do. You can actually end up with long COVID, which is what we're worried about. Now, the elderly, once they get infected with COVID, they end up lying in bed. And you know that you lie down in one bed for 1 week for the elderly. Elderly lie down in 1 week for elderly, you need 7 weeks of physiotherapy to get them well. Where in the world will we have 7 weeks of physiotherapy in this outbreak? You can't. You can't even get a hospital bed in the community hospital. I won't be surprised if Ang Mo Kio is converted into a COVID hospital later because the rest of the world is struggling as well. Yes, I agree that pregnant women should get vaccinated. If you're not pregnant now and you're trying, just go ahead, get vaccinated. Many nurses got pregnant after the vaccinations, and after that, they were perfectly fine. So no issues at all, go ahead. Pregnant women, you can get vaccinated. In fact, if you will actually have these antibodies delivered to baby comes out of the womb as a gun-trotting baby, a gun with snipers against COVID-19. So this is actually, it cuts both ways. It protects the mom as well as the baby. I want to just say a message of love to the family of Siti. She's a singer, Malaysia. I think it was the 4th or 5th pregnancy. She wasn't vaccinated. There wasn't vaccinations then, and she died. They delivered the baby by cesarean, and she was allowed to die a few days later. Come on. This is the worst thing that can happen to any husband or wife. I mean, to die. My heart goes out to Siti's family. Okay, how can we protect our commute? Again, mask, 2 layers, do a tie at the back. Make sure it's very, very close to the face. That helps very much.
Doctor, should we take up the last question, because I think we've hit the time as well. So
okay,
go for the last one, doctor.
Okay. Why we didn't choose AZAC? It is it's like if UAB SMN, why didn't you tell me to buy Tesla earlier on? They kind of chose and decided which vaccines they had the best opportunity to, and they just went for mRNA. And on the credit of the expert committee, they chose the very good vaccines, the most efficacious one there was. To conclude, the street market of an mRNA vaccine in March was actually $1,000 per pop. There's how much you had in your arms if you had the COVID-19, and there's how much you gave away if you refused. Thank you very much, Rishi. Thank you.
Honam, thank you so much for joining us. Bart, maybe you want to close?
All right. Thank you, Dr. Leong. Thank you, Rishi. That's very insightful. I've learned a lot about COVID today. Yeah. Okay. So let's do this. So just a few more reasons why we choose to invest with us, because we have been a trusted asset manager for more than 30 years. We have our own secret sauce to make it work, and the reality is that you will have institutional fund management expertise at your fingertips. And this allows you to customize your investing driven by technology. Also, as we are celebrating our 1-year anniversary, we are having a promotion ongoing. Do scan the QR code to download the application or visit the links, and then check out the promotion on our website. Thank you, Dr. Leong. Thank you, Rishi. And thank you all for attending our webinar. Have a good and safe weekend.
Okay, can I just try in one answer, one question? I have an excellent question here.
Right.
How do you get the elderly to get vaccinated when they refuse to?
Yes.
You see,
Good question.
I think it's a great question. And I want to use this platform to try to share out. You see, they don't listen to logic. In fact, many people don't listen to logic. If people listen to logic, everyone will just join UOBAM. Instead, they listen to emotions. I think I can beat the market. I think I'm better. I think I am smarter. In fact, I think I'm healthier than all the others and I won't get infected. But you realize these parents will do something with illogically, and the something is protecting their children. When it comes to protecting their children, making sure that their children are fine, a person who is 80 years old, 90 years old will say, let me die lah. You don't die. You son, you have many more good years to go. You don't die. Let me die in your place. So if you want to convince this elderly, you say, hey, mother, father, it's not for you, okay? It's for me. If you get infected, I will be quarantined. I cannot work. Okay, my boss will say you stay at home and I'm going to cut your pay. Number 2, on top of that, you pass to me. After quarantine, I will fall sick and then I'll go through it and I can still die. Number 3, if you fall sick in hospital, who has to visit you? Me. And I go to the hospital, I may also fall sick. In other words, when you your children and your grandchildren are put at risk when you don't go for vaccination. So you do it not for me. You do it for the baby in the house. You love the baby loves you. The baby wants to hug you, see you, touch you every day. And the only way that's going to happen is with vaccination. Okay? So ask them to get vaccinated. Not logic. Logic doesn't work. Emotional ties do. Again, if everything is logical in the world, then even the stock market will only be one straight line, isn't it?
Yeah, absolutely right. Excellent.
Right.
Excellent way to end it.
Thank
you guys.
Great. Thank you. We hope to have you on sometime in the future then.
Thank you. See you guys. Bye-bye.
Thank you.
Take care, Honam.